Hey everybody, and welcome to my video. Today I'm going to be telling you my testimony about how God has saved my life. So my testimony is somewhat long, but I'm going to do my best to kind of make it short for the sake of this video. My testimony is also very complicated in a way. There's a lot of bits and pieces that I know I'm not going to remember, but over time, as I'm speaking, I'll probably remember most things, so stay with me. Okay, so here's a quick rundown about my medical history. So I was born with Truncus Arteriosus. Okay, I've had 4 open heart surgeries, 3 catheterizations, a tumor removed from my head, and I also had a TIA, which is a transient ischemic attack. That was a mouthful, but I'll actually kind of give a quick little explanation of what these things are, or I'll just put a picture with the definition or something. I don't know. So when I was born with Truncus Arteriosus. And Truncus Arteriosus, I'm reading the definition directly from Google here. Truncus arteriosus is a rare congenital heart defect where the main artery, which is the truncus, that carries blood from the heart to the body and lungs is a single large vessel instead of 2 separate vessels. So obviously that's a huge problem, because I'm going to show you a picture of a normal heart, and then I'm going to show you a picture of what mine looked like when I was born. So there's supposed to be 2 different vessels, right? One carrying blood that has oxygen, and the other vessel that's carrying blood that doesn't have oxygen. In my case, it was one large vessel, so those 2 kinds of bloods were 2 bloods, oh my God. Those 2 things, they were mixing. So the oxygen-rich blood and then the blood that didn't have oxygen, they were mixing, and that's obviously very dangerous. So that's what was going on, and they needed to repair that. So they used a homograft. They used that as a way to separate the 2 vessels and then close patches and holes and whatnot in my heart so that it can pump properly. So I can imagine what the outcome of that would be like. Of course, I was a baby. I didn't really know what was going on. I was a newborn. I had my first surgery, this one done at just 5 days old. So I can't really say I know exactly how it felt or what happened, but I can imagine that would probably end terribly if nothing was done about it. So yeah, I had that done, and then that was done on August 6th of 1998. I was born the 31st of July, so a few days later. September 5th, 2001, I had the right ventricle to pulmonary artery replaced. Homograft? I don't know. Oh, okay. So a homograft was replaced for my my heart. So I'm guessing as I got older, my heart continued to grow, and so with it becoming more narrow, they would have to continue to replace it so that those parts and pieces could fit. So it was that homograft that they replaced then. So a homograft aortic valve replacement uses a human donor valve to replace a deceased one. A diseased one? Oh my God, I said deceased. A diseased one, offering advantages like a lower risk of infection and no need for long-term blood thinners. Yeah. So the advantages of using a homograft: it lowers the risk of infection, no need for blood thinners, and then it's good hemodynamic function, which means they have an excellent blood flow profile, and then there's lower risk for blood clots. So yeah, I've had that done in 2001, September. And following that, 2000, 2003, 2004, 2012, but not following that, I'm just going by what's in my history and how it was put. So in 2000, 2003, 2004, and 2012, I had cardiac caths for stents to the homograft. So again, as I got older, the homograft, the parts continued to narrow because I'm getting bigger and my heart is working hard, of course, to do what it needs to do. So for those 4 years, 2012, 2000, 2003, and 2004, they had to place a stent. I'm gonna put a picture of what a stent looks like. I actually even have a picture of the stent that's in my heart too. So I'm gonna put that as well. So fair warning, I'm gonna put a picture of my actual stent. I'm gonna put it right there. So a stent is a small expandable metal tube that is inserted into a narrowed or blocked artery in the heart. It helps to keep the artery open and improve blood flow to the heart muscle. Okay. So why is a stent needed? Stents are typically used to treat coronary artery disease, which is a condition where the arteries that supply blood to the heart become narrowed or blocked by plaque buildup. This can lead to chest pain, shortness of breath, and other heart problems. Okay, so yeah, I had that done 4 times. And then I also, in 2015, 2015 was actually with the last open heart surgery that I had. So in 2015, which was like the major surgery, that one took about 10 hours for that surgery. It took about 10 hours for them to do that surgery. I had a St. Jude aortic mechanical heart valve placed into my heart. I'm gonna put a picture of what that looks like right here. I don't think I have a picture of that in my actual heart though. I don't think I have that one. I wasn't given that, but I'll just put a picture of what that looks like right here. That surgery was a tough one. That was a hard one. That might be the only heart surgery that I can actually remember the experience of, because with the other ones, of course, I was young. I was small, like I was a baby. So I can't really say much about what that was like. The only people who I can actually call out to explain their experience during that was my family and what it was like for them. But as for me, I didn't remember them. But this last one, the aortic valve replacement to put in the mechanical heart valve, that was a tough surgery. That was tough. I remember finding out when I was gonna have that surgery. It's crazy. I went to the hospital with my mom. Regular appointment. I had to do, I believe, a stress test. I was on the treadmill. I don't think I did the bike. I think I did the treadmill this time. And wait till we get our results and stuff. So we have another appointment, follow up, and then they do tests. They do the echo and everything, and finally we get to the next follow-up appointment, and they tell us that my heart's not looking so good. I don't exactly know what was wrong with it at the time. It's a little fuzzy, but I do remember them telling me that I needed to have heart surgery. At the time, my mom did pray that it was going to be a catheterization instead. She didn't, we didn't know the extent of how bad things were. So, a cardiac cath, easy, simple. You won't have to cut chest open or anything like that. It's more of you insert through one of the large veins or arteries, and just do what you have to do. But this wasn't that kind of surgery. So with this one, I was confident in this one. I was confident with this surgery because honestly, I don't know. It's just at the time I wasn't afraid. I wasn't scared of what was going on. I just wanted to get through it. But when they told me, of course I was surprised. I was shocked, but my mom was there and she immediately, she was crying. She started crying right away. And so in my heart, I'm like, yeah, there's no way I'm gonna be able to sit and watch her crying like this. So I'm just like, no, it's fine. It's okay. Everything's gonna be okay. It's all right. It's whatever. I prefer that anyway. I'll prefer the open heart and whatnot. Why I was saying these things, I don't know. It's just that I felt like I needed to be strong in that moment. So I did. And not only was that a huge shock for the both of us, but that was also the year of my senior year in high school. So a lot was happening at the time. Um, yeah, so the time was winding down. I was getting ready to do the surgery, and it finally came the time for it to happen, which I don't even think was long after us finding out, like maybe weeks, months, I don't know. But I had the surgery, and I woke up from that surgery a few times from what they're telling me. I don't know, but I only remember 2 times that I woke up from that surgery. The first time I woke up, I guess it was from when they was trying to remove the tube out of my throat. I have a video of that. If I can, I'm gonna put it right here. A video of how I looked and what it was like for me when they took it out. That was like right out after surgery, so I was probably still under some heavy medication. I didn't really feel anything except that they removed it, and I was just coughing and coughing and coughing. But I'm sure I went back to sleep after that. I think I did, because I remember waking up the second time, and I woke up just so normal, and I'm looking around, probably still gone with those drugs that they was giving me for pain, and I'm just like, oh, my room looks nice. This is really nice, because at the time my parents were remodeling the house, so I'm like, dang, my room looks good. But it took me like a couple minutes to realize, okay, I'm not home. I'm in the hospital. Like, it's crazy. I woke up from that one, and I recovered fine. I recovered very well from that surgery. Obviously, I'm still here. It was a roller coaster, because with the thing about the St. Jude, well, not, I'm not going to say St. Jude. I don't know how many there are. The thing with the mechanical valve is that it makes a noise as your heart is beating. And for the first couple days, I kind of like looked past it. I was just like, okay, I'm recovering. I just want to feel better. I just want to do normal things again. And so it didn't really like hit me until maybe like a week or two later. And I'm like, wait, my heart, like this sound is like, is really loud. If I sit quiet, you probably have been hearing it the whole time that I was saying this, but like when I sit quiet next to someone, they can hear it. So I'll be quiet and see if you can hear it through the video. So it's like a ticking sound. It's like a watch. I think that's what bothered me the most throughout that surgery. Well, throughout that whole process, because it just kept ticking and ticking and ticking and ticking and ticking in my head. And it was kind of like driving me crazy a bit, because yes, my heart was repaired. My heart was fine, but it's like, okay, how am I gonna live like this? Like, how am I gonna sit and listen to this thing all day? It was not easy for me, because I still had one more year of high school. I was still trying to be normal. And all I could think about is the fact that now I had this ticking time bomb in my chest. And I'm going to be on blood thinners for the rest of my life. Looking back at it, I really could have, I can't go back and change how things were, but I cried often about it. I cried and cried and cried and cried. Now that I sit and think about it, like, okay, there's sometimes I'm sitting there and I don't even remember that it's ticking. I don't remember it, but it still bothers me because it's constant. But I'm just happy to be alive. I just thank God that I'm still here, because things could have been worse. A 10-hour surgery, that could have went way left. But I'm still here. Still breathing, still walking, living, and gonna be on meds for the rest of my life, but I'll take that instead of being 6 feet under or stuck in a hospital bed for the rest of my life, in a coma or anything. That was a tough surgery. I've had so many dreams while in there, like seeing the most craziest things, like my body just in the bed with maggots all over and death and things in my window and things like it was very, very, very traumatizing. It was very emotionally traumatizing at the time. But looking back, it doesn't even feel like I went through that. My body had my body went through some things in that surgery. But moving on. So, I had a tumor in my head or mouth. I don't really know how to explain the positioning of where it was. So I had a tumor that was found in my head, and believe it or not, it was my mom that discovered it. So my mom watching me, I think I was in middle school at the time. I think I was in 8th grade, starting 8th grade or middle of 8th grade, I don't know. And mothers always see things. So my mom, she noticed that my face started to look a little different on this side. And it was like the slightest change, the slightest difference that you could ever imagine. The smallest thing. And she was like, yeah, something's wrong. And I'm like, what's wrong? I don't see nothing. And she's like, no, something's wrong with your face, something's swollen. And I'm like, okay. So I used to have a lot of these like abscess, I don't know how to call them, but or cysts, I don't know, in my mouth, like these bumps that would fill up with things, over time. So we just assumed, okay, maybe that's it, but this one's kind of big. So we went to the dentist to go check it out, and we did an x-ray and a few other things, a couple tests just to see what it might be. And after looking at the x-rays, the doctor was just like, yeah, this doesn't really have much to do with her teeth. I don't think it has anything to do with how her teeth is forming or anything of that sort. So I think you need to go and do a biopsy just to see what that mass is in her face, my face. And so we went to this other hospital, and it was the quickest thing ever. I was in and out. They put me in the chair and they told me how it was gonna go and stuff. And I was like, okay, cool. And they put me on this laughing gas. Well, laughing gas. I don't know what it's called, but they put me on laughing gas, and it was so chill. Like it was like the easiest, quickest thing ever. They did the biopsy. I felt things, but not like pain things. I felt things, and I felt them moving around and whatnot, and I'm just here laughing my butt off. They did the biopsy, and then that was done. I went home. My face was just big, and then we waited for the results. And so we get the results maybe days later. I would say days, weeks. I don't know. And we get back to the hospital where they were ready to tell us what's going on, and then it turns out I had a tumor in my head. So originally we was like, oh, a tumor? Like, what do you mean a tumor? But they were saying it was benign, so that's not really it's not cancerous. Thank God. Thankfully it wasn't. But yeah, it was there, and then it was like it was continuing to grow where it was. And so he was like, yeah, we have to remove that, because if you let that sit in there and continue to grow, it really could affect a lot more than you think. So where it was, like, I would say, just off of the markings they made on my face, where I'm assuming, it was near here, in this area here. But how big it was, like the mass, I don't know. But it was in this area here. And so when they was getting ready to do the surgery, they decided that they would go from inside. I don't know if that's how it normally is, where they go from inside normally, or if they ever have to make an incision on the outside. But I'm just glad it was from the inside. So they did the incision from inside, and they were able to remove the mass. They removed the tumor. And again, thankfully, it was nothing cancerous. It never returned. It never became anything worse. But they did say that if it remained there, then it could have affected my vision. It could have affected my vision and God knows what else. But I thank God and my mom that it was caught when it was caught, because who knows what that could have turned into. And that was the last thing I needed to deal with. So this surgery was before the aortic valve replacement. So that was before I had that last surgery. So this one right here, I don't know. I feel like this surgery, even though I said I cried a lot with the aortic valve replacement, that tumor being removed from my head, that one right there made me cry more than any of those other surgeries that I've had, because I cry about it to this day. And not because, okay, I had surgery, they removed the tumor. Thank God they removed that tumor. I'm happy, but the thing about this one right here is that it took a lot more from me than I would have liked. Now, this is not me saying that I'm not grateful. I'm grateful because it was done quickly. They did an amazing job, and I'm just glad to have my life in my sight, you know? But when they did the surgery, so first when they did the biopsy, they had to remove 2 teeth. They removed those 2 teeth. They did the biopsy, and they was able to, I still had baby teeth at the time, by the way. So they was able to, after they took out the tumor, they pulled down the other 2 teeth. They moved those 2 teeth and put them in place. And then I was good after that. I was fine. And then they closed up. But when they did the actual surgery, they had to remove those 2 teeth as well. So not only was the baby teeth gone, but the 2 adult teeth are gone. And immediately that did not affect me right away, because I'm like, well, I have my life. I'm alive. I'm breathing. I can see. Who cares? Thank God I'm here. It was not easy during the months after that, years after that, and even today, because I'm a very happy person. Obviously, you can see I like to smile a lot. I smile a lot. And it wasn't until they actually saw me in a follow-up after the surgery, and they was like, yeah, everything went well, but, we're sorry we ended up having to take, more teeth from you. And I was like, huh? What do you mean? What do you mean more teeth? I don't know what you're talking about. So yeah, they ended up taking 2 more teeth from me, and now I'm just like this. So years have went by, and I'm still to this day not like confident like I used to be. I don't smile around people like I used to. I used to have like the biggest, brightest smile. I can't even smile around people. And my confidence has really, 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 really dropped so low because of it. But it's like every time I sit and think about it, I'm like, but I'm alive. I'm still here. I'm living and I'm breathing. Thank God. And this can easily be fixed. So I thought. But yeah, so years later, I'm like, maybe let me just go ahead and try to get this done. Let me just fix my teeth so I can, smile again. And I went to the dentist. I said, how can we fix this? Can I do implants? Can I do braces afterward? What can I do? And so it turns out now there's like a hole there. So there's bone that's missing. And I would have to have a bone graft to actually make bone there, to actually put teeth in. So my insurance is not covering these things, so that's hard. That's a tough one that I'm still battling today, because I love to smile, but my confidence is like gone now because of it. But I said, you know what? At the end of the day, I have a testimony to tell, and I'm gonna tell it, because out of all the things that I've been through, this can't be the one thing that's still holding me back from speaking and telling people about what God's done for me. I know I'm still gonna have days when I cry about it. I'm gonna look at myself in the mirror and be like, wow, that was something. But no matter what, it's not gonna take away from God's glory, because I'm still here because of God. There's no way I would allow this to stop me from praising God. I'll get over it. eventually. It's been years, but I'll get over it. It's like, it's not gonna kill me, because I could have died. It could have been worse. But I'm just glad that I'm alive and well, you know? So one day I'll be able to afford it. I'll be able to raise the money. I'll get my teeth fixed. And that's a easy 1, 2, 3. But my life, to lose my life, that's not to be fixed by 1, 2, 3. It's not like that. So that was that. I know this was the same year I had a heart surgery. So not only did I have the tumor removed that year, but I also had another heart surgery that same year. So those 2 big old blows in 1 year, that was a lot. That was 2 years. 2 operations in 1 year, and it took a toll on me. And I was in middle school. I was in 8th grade at the time. So yeah. Then I don't remember the year, but I also ended up having a TIA, which is a transient ischemic attack. I'm gonna look that one up because I don't want to mess up this definition. A TIA, which is a transient ischemic attack, I'll put the definition right here. It is a mini stroke caused by a temporary blockage of blood flow to the brain. Symptoms are the same as a stroke, but last for a shorter time, usually resolving within minutes to hours. A TIA is a medical emergency and a major warning sign of a future stroke, so it's crucial to call 911 immediately to get evaluated. So this happened normal day. I think I was sitting at a wedding when this happened too. I was just sitting talking normal, and then all of a sudden I felt my face. I was speaking to my sister, right? So she was sitting in front of me, but she turned back, of course, to speak to me as I was sitting there. And then as I'm speaking to her, the words that I was saying just started to feel like it started to jumble up. Like I didn't know what I was saying. So I'm just talking and things are coming out of my mind, and it's like whatever, like mumbo jumbo. And then as I'm speaking, I felt the right side of my face just start drooping. Now, I don't believe that they could actually physically see that because, of course, they didn't say anything. But my face, it felt like it was just dropping on one side as I'm speaking to her, as I'm speaking to my sister. And out of nowhere, I just all of a sudden, I just went back to normal. And I'm like, okay, what just happened? And I didn't say anything for that night. Now, I know if I told my mom that night, I'd be rushed to the hospital right then and there. But I was like, you know what? No, I'm good. I'm fine. Nothing happened. It's normal. I told my sister that night. My sister and her husband, I told them that night about what happened. And, of course, they were really concerned and worried. But the night ended, and then we, went to sleep. That next morning, I got a phone call from my mom so early. It was like, what happened to you? What on earth happened at the wedding? You didn't say anything. And I explained everything to her and what happened. And she was like, oh, heck no, you're going to the hospital. And so I went, and it turns out that I ended up having the TIA. And ever since that time, I had been on high alert with myself. Like, okay, I have to be careful. I have to watch out. I have to be careful for what I'm doing. Now, at this time, I had no idea what a TIA was. So in my head, I don't even think I thought about a stroke at the time. Like my head wasn't there, but I was just afraid that whatever it was going to be worse than I thought it was. That's why I didn't say anything. But bad idea. If something is going on like that, you have to speak up. You have to say something. But I didn't want to say anything because I was afraid of what it could be. But thank God Almighty, it didn't become worse. It wasn't bad. It wasn't life-threatening. Well, of course, it's life-threatening, but basically what I'm saying is I was able to get out of it easy instead of needing actual medical attention or medical interference. I was good. I went to the hospital. They discharged me, after some time, and then it was like, I just have to be careful. So that happened. And then, a couple of years go by and I'm fine. I have my mechanical heart valve and, I'm chilling. No other TIAs. My head is doing fine. But following the TIA though, when they did the CT scan, they checked my brain. They did notice changes in my brain, but it wasn't anything significant, like anything that was on like high alert. I didn't need to be on high alert. It was just that changes happened, but I'm doing just fine. So that was okay. Okay, so years go by after my last open heart surgery. I've had, a few run-ins in the hospital, in and out, but nothing major. Just, being careful and going to the emergency room when things change, just to be, mindful of myself, just to make sure everything is all good. Years go by and I'm living a normal life, and God is like taking good care of me because I'm like staying far away from the hospital. I'm doing good. I'm taking my meds, and I'm just rejoicing and living my life. And then soon I get married. I ended up getting married, and I was with my husband for 2 years before we got married, and we got married and stuff. And then, because I was getting married, because I have a good relationship with my cardiologist. So whenever something significant happens, we speak to each other just so we can be on the same page about things, so that my heart is 100% healthy. I'm good. I'm just in the best shape that I could possibly be. So he then finds out, okay, well, you're getting married, so you're gonna have to, if you plan on having kids, you're really gonna have to be careful. You're gonna have to, like, if you plan on having kids, we have to be prepped for this. Like, we have to be prepared for all of this to make sure that everything from A to Z is planned out accordingly. Because with me, the thing is, with being on blood thinners, having a baby can be very dangerous. Okay, so I'm on warfarin, and while pregnant, I shouldn't be on warfarin because of my baby. So I'm gonna put what I'm gonna read. I'm gonna put right here so you read too. But warfarin is not recommended for use during pregnancy because it crosses the placenta and can cause serious birth defects and fetal bleeding complications. The risk is highest in the first trimester during the critical period of fetal development. All right, so that's the that's one of the main reasons why my doctor really wanted to know beforehand if I'm gonna get pregnant, if I'm gonna try to get pregnant, if I really wanted to do this. My heart was already not in the best shape that it could be, because even though my aortic valve was fine, now I have the mechanical valve. My mitral valve was not doing the best that it should. So that one was already having some complications, and we were speaking about me having a catheterization for it before, but never actually got to it because, everything was kind of stable. There was no dramatic changes, so we left that alone. But he was really on me about it. Like, if you plan on having a baby, you gotta, we have to plan this before you do. And so I always kept that in mind. And I always thought, and I spoke to God, like, okay, is this even possible? Like, can I have a baby? Like, is this gonna work out? In the beginning stages, when I used to talk to him about it, it didn't scare me. It didn't, worry me or anything. I had faith. I wasn't scared about none of that. But as time progressed and, I got married and I was more serious, I was like, okay, how is this gonna affect me? Now, when a few months went by of us being married, I started to think about it more. I started thinking about having a baby more often. Not because I felt like we were missing something. It wasn't that we were lacking anything, but it was more, let me just say, sometimes when people don't know what you're going through, what you're dealing with, and they decide to push you in a direction that is dangerous for you. It was like that. So, yes, I wanted to have a baby. My husband wanted to have a baby. Now, were we forcing ourselves to have that baby? No, we talked about it. We talked about options, and we were good with waiting or whenever we was prepared to have one. The thing is, though, is that a lot of pressure. I'm getting a lot of pressure from outside, so it kind of made it hard for me to really just relax and think about it later. But the time came and I was like, you know what, fine, okay, maybe I could try and have a baby. Let me see. Let me just see what the income would be like. Let me just see how it's gonna work, the outcome, I mean. So I spoke to my doctor again, my cardiologist, and I asked about what the process would be like. Well, honestly, he always brought it up to me. It wasn't me that brought it up to him, but I guess because he knew that, okay, we're newlyweds, let me just keep you guys informed about the dangers and the risks, and he's an amazing doctor, so I thank him for that. So here's how the process would work when being pregnant while on blood thinners, while needing blood thinners. So not only do I already have a heart that's kind of like always on life support, like it's always just, my heart is like, it's been through some things already. But with the mechanical valve and being on blood thinners, I cannot be without a blood thinner. Because essentially having a mechanical valve, a mechanical piece in your heart, your body is like, it's thinking that's a wound. Like it's thinking that's, that there's something wrong, like, so let's try to fix it. So it'll try to form blood clots around it to stop the bleeding or to stop, from things from, being open or whatever. It's trying to repair itself. So the blood clots will be attracted to that piece of metal because it's a foreign object in my body. Like, where does this come from? This doesn't feel like it's supposed to be here. So to replace the warfarin, in a way, I ended up being on something called enoxaparin, but it's an injection. So basically he was saying, okay, so from day one of your pregnancy to the very end, I'm going to need to be taking these injections to my stomach twice a day, one in the daytime, one in the afternoon or midday. They had to be 12 hours apart, basically. So that drug, what it does, I'm going to read that. It's an anticoagulant or blood thinner used to prevent and treat dangerous blood clots like deep vein thrombosis. So basically, I had to take it subcutaneously because if I did it that way, then it wouldn't reach my baby. It wouldn't reach the womb and all that stuff. So twice a day to my stomach, like, my skin is very sensitive, so that was not easy. So that's how it would end up having to be. Twice a day, I would have to be monitored quite often. I would have to, be careful for everything, basically. And I weighed these things, like, okay, my life versus a new life. Like, is it worth it to put myself through this thing? And after constantly speaking to my husband and stuff, I'm like, you know what? Okay, maybe we should just give it a shot. I have faith. My faith is crazy. The thing is, I just believe that, it's possible. If God willing, it's possible. It'll happen. It'll come when the time comes. If it's in God's will, it's gonna happen. And so we were only married maybe a couple months at this time. And no, I did not plan on trying to have a baby right away. But again, a lot of pressure. I put my faith and my trust in God. And I spoke to God and was like, okay, God, what I'm trying to do is very, very risky. It's risky. It's really risky. But I know that this is not impossible. Like, it's not impossible for God. I know it's not impossible. But I was going back and forth with myself, back and forth, because I was just nervous about, okay, well, God, is this really in your will? I don't want to be an example for someone to be like, okay, well, yeah, I'm not going to try that because look what happened to her. I didn't want to be that example, but I had to put my faith out there for this. So I prayed and spent months praying and months and months and months and months. And for a while, we were trying to conceive. And I'm like, okay, when the time comes, it'll happen. It'll happen. But of course, knowing me, my anxiety and all the voices and people, I'm really forcing. I'm like, I'm pushing for this thing. And so I just prayed and prayed for months and months and months. But before those months of praying came, I spoke to God and I was like, okay, what I'm asking for, I know is not simple. It's not simple. It's not just, it's not something to be taken lightly, because this is my life that I'm putting on the line. This is my life. I didn't want to be selfish. I understood this is a decision that's supposed between me and my husband. And this is also ultimately just my decision, because it's my heart, my life I'm putting on the line. But it's like, I didn't want to put myself in a situation where I would end up leaving my husband behind. I didn't want to do that. But I had faith, and I was like, okay, well, God, I really need you on this, because I would love to make this happen. Like, I would love to see this happen. And I would be devastated if it turns out that I'm never able to have a child. But also, I want to live, like, I don't want to just die, but so months and months go by. But before that, I spoke to God and I was like, okay, God, I know that what I'm asking for is crazy. I know that what I'm asking for is a lot, but I trust you. I have faith in you, So essentially, it's going to sound crazy, but I made a deal with God. I made a deal. Like an actual deal. And I was like, okay, God, because after all these months of praying and fasting and praying and fasting, I don't know if you hear me, I'm praying because I want to have this baby. I would love to have a child. Like, I really want to have one. I don't want to be put to shame, because I'm already looked at as being the girl with the heart problem. I kind of feel like people look down on me sometimes, like, oh, well, she can't do anything, oh, she's damaged goods or whatever. And I felt that way for a while, but I was like, okay, God, I don't want to be put to shame like this. If you give me a child, God, that child will be for you, and I will testify. I will testify. I will write my testimony. I will tell my testimony. The glory will all 100% be for you, God. 100% if you give me this baby. And I made that prayer for weeks and weeks and months. I prayed that same prayer and I said, God, if you give me this, I will do this. You give me this, I'll do this for you. I will testify. And there isn't anything that we can actually do for God. He doesn't need anything from us but glory. All he asks for is glory. The glory and worship. And I'm like, okay, my testimony, I can worship you with my testimony. I can give you glory with my testimony. You just give me this baby and I promise I will testify. I will tell my whole world my testimony. The whole world my testimony. Everyone will hear it if you give me this baby. If you make it happen for me. Because I've been through some things, and I know childbirth is not easy. It was not easy, but I had open heart surgery. I've had tumors in my head. I've had a stroke. I've had a lot of things happen to me, and I was a whole newborn. I was fresh out the womb dealing with these things. I'm like, God, you did all that. There's no way possible that this is impossible. I know for a fact that if you can do those things, you can do this. You raised someone from the dead, you can do this. God, you've healed sicknesses that are deemed incurable, then you can do this. You can do countless miracles. This one that I'm asking for is nothing compared to what I know that you can do. And I made that prayer often. often and often, often. I'm like, God, I know you can do this. You can do this for me because you've done those things. This is nothing compared to what I know that you can do, or things that I haven't even been able to think about that you can do. I put my faith in God because I know God is powerful. He's all powerful. There was a part of me that felt like it's not going to happen, only because I'm like, okay, I think maybe I am asking for too much. Am I asking for too much? Like, am I really trying to like put my life on the line right now? Like, am I really doing this? But the other part of me was like, okay, well, pipe down. Listen, you know who your God is and you've seen what he can do. There's no way possible that I'm going to sit here and believe that he can't give me a child. Like, come on. I've woken up from a 10-hour surgery. I've had hands in my chest, hands in my heart out on the table, all these things physical, like happening to my heart, my body, my mind, everything. And I'm still here. This isn't going to take me out if God says so. So I prayed and prayed and prayed and prayed and prayed and prayed and prayed for months and months. And I sat and thought about my history. I'm like, yo, is this really what's going to take me out? Me having a baby? But then I'm talking to the other side of me and I'm like, no, God's got this. And I'm praying and praying and praying and praying. We tried. I fasted too. And we're praying and we're trying and stuff and nothing's happening. And finally I got to that 11th month. Not even a full year yet. Can you believe like how much people can talk and the pressure can cause you to do something so wild? But I did want this baby. I did, but I wasn't going to rush it the way I was rushing it without that. So I got to the 11th month, 10th month. It was October. I remember it was October. And I'm like, okay, I was home alone this time. My husband was at work and I'm just praying and praying loud in the house, just praying, speaking to God and praying and praying and praying. And at one point I turned around and I started speaking to the devil. And I'm like, you know what? The devil is a liar. I spoke directly and I spoke directly to him and I was like, you know what? God is going to put you to shame. He's going to put you to shame because I'm going to have a child. He will bless me with a child. I have no doubt that I'm going to have a child. Speaking directly to the devil, just speaking and speaking and speaking and speaking. I'm saying God is going to do this. He's going to do that. God is going to heal me. God is going to help me. He's going to protect me. He's going to give me a baby, whether a boy or girl is going to be healthy. All this I'm praying in Jesus' name, and I'm speaking directly to the devil. I'm like, you know what? God's got me. He's not going to let anything happen to me, and I'm going to have a baby. Now, here's where I overstepped a bit. Not overstep. I'm not going to lie. It's okay sometimes to push the limits, to push towards things for God's glory. But here's the thing, though. This was like one of the craziest tests ever. I said, by next month, I'm going to have my baby. Next month. I said that firmly. Next month, I'm going to have that baby. And I had confidence. And I'm praying. I'm talking to the devil like, yeah, God's got me. He's got my back and he won't put me to shame. That next month came. And I was so nervous. I'm like, dang, I really said that, huh? All right.